Hello, my name is Dr. Rebecca Perkins. I'm an obstetrician gynecologist at Boston University Medical Center, and I was one of the lead authors on the 2019 ASCCP Risk-Based Management Consensus Guidelines. These guidelines represent an improvement in cervical cancer prevention because they optimize focusing treatment on high-risk patients and allowing lower-risk patients to avoid invasive procedures. However, the guidelines can be a little bit confusing because they take into account the test results from today as well as past test results. So my team designed a website which is freely available to the public at cervicalrisk.com to help patients understand how to use these guidelines. So the website is available in English and Spanish, and it contains information as well as a personalized risk assessment. If someone just wants to learn information about the HPV vaccine, they can click here, and it describes what is HPV, how do the vaccines work, how effective are they safe? Yes, they're very safe, and they're very effective. Who should get the vaccine? Will the insurance cover it? And how effective is HPV vaccination at older ages, which is not as effective as at younger ages. And then there are links to trusted resources like the CDC, the American College of OBGYNs, and the American Cancer Society. Similarly, if a patient wants to learn about HPV and Pap test information, they can come here and it will talk about what causes cervical cancer, why do we screen, and how do we screen? And again, links to guidelines and trusted resources. But the most important, I think, part of the site is the personalized risk assessment. So this allows someone to go in and put in their personal history and find out what is recommended according to guidelines. So let's say someone has just had a Pap test and they want to know what to do. So let's say this is a young patient, maybe 22 years old. And she says, well, I think my last Pap test was, well, I don't know what these letters mean. So you can click on the I button and it will tell you what the different results stand for. Now, I will say it is important if a patient is using this, they need to have their medical record with them because you actually need to understand the medical terms or enter essentially the medical terms to get the correct recommendation according to guidelines. So let's say this patient was simple. She had a normal Pap and the screen will pop up and say, this is a normal screening result. If you haven't had an abnormal test result in the past, you can have your next screening in 3 years. And then it says what it is based on. And if someone wants to learn more, they can always click to the glossary and it will describe all of the terms that are used in the website. Now we'll do a different example. So let's pick someone who just had an abnormal test result. So let's say they're 27 years old. They had a positive HPV test. Sometimes HPV tests will come with a number in the medical record. Sometimes they don't. 16, 18, and 45 are high risk HPV types. And so those have different management. But if someone doesn't know what the number was, or the HPV test doesn't have a specific type associated with it, they can click other or I don't know. And then let's say their Pap result was this very common abnormal called an atypical squamous cells of undetermined significance. You'll say, did they have a Pap test before? And you say, no, I don't remember what it was. I don't have the record for that. And they say, were there any prior abnormal results? No, there weren't. And then it will say, okay, this result is recommended for a colposcopy. A colposcopy is an examination in the office where the provider examines the cervix using magnification and may take a small biopsy. And then if you click, it will take you to the National Cancer Institute website that tells you more patient-friendly information about what that test is. And it also tells you where this management came from, which was the 2019 ASCCP guidelines. And it also tells you what your current risk of having precancer is, which would be, in this case, 4%, which is why a biopsy is recommended, and also what the risk is of developing a precancer over the next 5 years, which is 7%. So now I would like to go through an example of a higher risk result. So this is a patient who is over 25, has a positive HPV test. It's positive for HPV type 16, which is one of the most aggressive HPV types. And then they have an H-cell Pap, which is a high-grade Pap, which is a higher risk Pap result. And the recommendation is actually that the patient have treatment because they most likely have a precancer. Their current precancer risk is 60%. And so the recommendation is that the provider will talk to them about doing a LEAP procedure, which both gives the information of a biopsy, but also treats the precancer at the same time. And the patient certainly can prefer to have a colposcopy and can have that done instead. And then if people are interested, they can click here or here for more information from the National Cancer Institute about colposcopy and LEAP procedures. And so essentially, you can go through, you also, if a patient has biopsy results, they had just maybe had a colposcopy with a biopsy, they can go in and say, oh, what was the biopsy result? And we're going to say this, in this case, the biopsy was normal and they had a low-grade Pap before the biopsy. And it will say, okay, well, what do you do now? Now you follow up in 1 year for a repeat test. So you can sort of start anywhere in the process with whatever the patient's most recent result was and figure out what the next thing is to do. And it's all written for patients in patient-friendly language, but people definitely do need their medical records so that they can put in the exact terms. I hope this is helpful. And please use the site and share the site if you think it would be helpful. Thank you very much.